interesting. I'm gonna take it. I'm just gonna do voice.
So the hysteroscopy D&C, that's going into the cavity of the uterus. That she's going to get a copy of all these pictures.
Okay.
We're inside the cavity. It looks pretty normal, both sides, but I don't know if you can tell. Can you see a little? It's a
like a line. Yeah.
Well, it's a projection. There's
yes,
a little,
I see that.
what we call subserosal fibroid. It's a fibroid, tiny one. It's about 1.5 centimeters, poking into the cavity of the uterus. Okay, so I did get that out, and kind of cut it out there, and then remove it. Okay, it's hard. These are bubbles, but this is a 2D picture, but I'm kind of seeing things more 3D. But this thing is kind of a little pimple poking into the uterus, but it doesn't have pimple stuff in it. It's a hard, it's a little fibroid. They're firm and rubbery kind of things. And I scraped all that tissue out. So this is where it was before, and that's where it was after. So that's inside the uterus. Now we go. That was the main thing I wanted to make sure we covered, was the inside of the uterus stuff. And then to try and look for what's going on inside her belly. So through her belly button, quick look up at her gallbladder and liver look very normal. Okay. Here's the uterus. Here's the top of the uterus. She has another one of those little fibroids. This time this is on the outside of the uterus. This is more of a subserosal fibroid. Again, about the same size as that one was on the inside. So this again is a little bump on the inside, or on the outside, I'm sorry. Right ovary looks very normal. Right fallopian tube, very normal.
Okay, she's worried about that.
The right side looked fine. On the left ovary, we had this little cystic thing. Little follicle, little cyst. It's not very big. It was only about 1.5 centimeters as well. And it was kind of sticking off the ovary there. This could be an old follicle. This could be an old tumor that was benign. I took that off, and we'll send that to pathologists as well. It didn't look cancerous, but we don't know for sure until we take it and have the pathologist look at it. Here's the left tube, look fine. There's that little jobber again. Okay, these are measurements. So that was about 1 centimeter. That's 1 centimeter from here to here. So that serosal fibroid was only about a centimeter. This is the area back behind the uterus. You can see that left ovarian cyst. You see a little bit of the right ovary. Just looking for endometriosis or scar tissue, anything else inside. Didn't see anything else. So we take off that little cyst on the left ovary, took both tubes out, took that little fibroid off, made sure nothing was bleeding. This is where the right tube used to be, right ovary still there. That's where the left tube used to be, left ovary still there. I did take that cyst off. I didn't take another picture of it. And then after I took that fibroid off, sometimes things like to get stuck to raw tissue. So I cover up the uterus in this, looks like cheesecloth. It's called Interseed. It's to decrease scarring and stuff like that. So that's all that's for. So we did the D&C, found a little submucosal fibroid inside of the uterine cavity, took that out. Took a little fibroid off the top of the uterus. That's a subserosal fibroid, again, small one. Took both tubes out. Okay. Took the cyst off the left ovary. And then very hemostatic at the end of the surgery. There were no complications. We'll send all that to the pathologist. They'll cut it up, look at it, and give us a reading on everything. There could still, on ultrasound, we did see another fibroid that was actually bigger than those. But that, again, that's in the walls. That's kind of in the uterine, muscle's thick, and so it's going to be sitting in the thickness of that wall. There were a couple little ones that were on this side of the wall and one on that side of the wall, so we was able to remove those. I don't know if those are contributing to her pain at all. Certainly the fibroid inside the lining of the uterus, inside the uterus, submucosal fibroid, could be contributing to her bleeding. So that was important.
So none of those you think contribute to her back pain?
Her back pain? No, they're not that big. Those ones aren't that big. The one inside the muscle of the wall, which I can't see by looking on the outside or the inside, might contribute a little bit more to her. I mean, she's got kind of a bulkier, bigger uterus, but you know, just the uterus itself being where it is, and then she's got a little bit of prolapse where the uterus is prolapsing down through the vagina. That could contribute to some back pain. But she was more complaining of right lower quadrant pain that would come on for just a few seconds and go away numerous times a day.
But she's really complaining about her back.
Oh, she has. Well, I
yeah,
didn't much
her
of
back,
that.
lower back is killing her.
Maybe that's one thing she doesn't tell me because she doesn't associate it with the pelvic stuff. So that's hard to tell. Back pain is very multifactorial. A lot of things contribute to back pain.
So none of that looks cancerous. So that's good, right?
Does not. But again, we're gonna. That's why we're doing the D&C most specifically, is to rule that out. Okay. So she's got the 3 incisions, one in her belly button, one above her pubic bone. That's the little bit bigger one that I had to get the little fibroid out and the tubes through, and a small one on the left side. So 3. We give them some extra numbing medicine, a stitch underneath one, a stitch underneath that one. This one didn't even need a stitch. We just glued it. Okay. Some watery bleeding from below. She's back in the room you all started in. Once she's awake enough, they'll have you come on back. Okay. And then I need to see her in about 2 or 3 weeks. Okay.
Okay.
All right.
Awesome. Thank you.
Nice to meet you.